Hello and welcome. Thank you for joining us today for our webinar, 6 Strategies to Conquer Complex Categories. My name is Megan Ellis. I am the Product Marketing Manager at Conductiv, and I'm excited to be joined today by two of the experts from our sourcing team, Malia Moore and Adam Ellsworth. Malia and Adam are both armed with practical sourcing experience and a plethora of lessons learned, so they're going to be taking us through the best practices of sourcing complex categories. We know that within healthcare, purchase services is vastly undermanaged for a myriad of reasons. Where the supply chain is generally understaffed and underinvested, it's frequently the case that too few resources are available to address the complexities of measuring indirect spend and optimizing supplier strategies. We know through experience that purchase services account for a significant amount of operating spend and offer up to 24% category savings. Aggregated across the industry, there is about $39 billion left on the table annually that are up for grabs. The goal of this webinar is to help educate sourcing professionals on how to optimize their contracts and find the greatest savings opportunities in some of the trickiest categories to source. Adam, I'll turn things over to you to kick things off.
All right, so I think we'll start with just the question of what we consider a complex category to be. So for starters, we're not talking about commoditized products like med-surg, services with easily defined specifications, or simple services. Complex categories to us are often those with a political consideration, categories that may be generally considered to be strategic by the organization. Uh, so how do you identify a complex category within your organization?
Yeah, let's start with what makes a category complex. In my mind, there are a couple of groupings of these types of categories. Categories that are inherently complex and simple categories that are made complex by internal factors.
Yeah, so the ones that immediately come to my mind then are things like waste management, where you have a lot of containers, lots of different modes of service pricing. For instance, prices by the container, by the pound, by the ton, etc., or suppliers that may just roll everything into one opaque monthly fee.
And beyond just the immediate category you're trying to contract for, there are many factors that can complicate a sourcing initiative. Most of these include institutional variables, and we've seen things like environmental factors and service variance, things that are specific to one facility, something that makes it unique, or vendor-related complications where a single vendor in the area has a lot of leverage.
Mhm. Yeah, it can also include things like organizational size and geographic complexities, where you have factors such as the inclusion of hard to service or outlying rural facilities, systems that are spread out across a large geographic area. Also, as I mentioned, political factors such as relationships with stakeholders, project sponsors, or even your vendors. And then also you have categories where there are complex data requirements. Sometimes data collection in itself is difficult, or you don't even know the types of data that you'll need to collect in the first place.
And a couple other complicating factors can include, where there are regulation-heavy categories, especially in organizations spanning multiple states or categories with unions. And if the service is a new service or if the delivery model is changing from the current state of operations.
Great. So now that we have a good idea of what makes a category complex, let's talk about some of the strategies for overcoming these challenges.
So probably the most fundamental step is to begin by defining the scope you're trying to tackle. This is a really obvious way of controlling complexity. And for any project, you can consider what facilities are included. Are we talking about just acute sites, or are we including clinics? What service lines are we talking about, and what's the current state?
Absolutely. And so, in a lot of ways, setting the scope allows you to then focus on your goals from there. And it's very important to define what's in play, what the objectives are, and what success actually looks like. So, it'll also define the requirements and some of the considerations that we'll be discussing later on.
And this step can be impossible without the stakeholders and end users. If they are not in alignment, you may need to leverage the executive sponsor group to change from the top down.
So there's tremendous value in bringing all those groups together, not only to try to align goals, but also to understand that different groups are going to have different interests and that conflicts will arise as a result. Oftentimes, the final result will involve making trade offs, and understanding the key concerns and values of each group will help to resolve those conflicts in the best interests of the organization.
Yeah, let's use waste management as an example. We've got many different waste streams with differing pricing methods with different vendors. Waste needs to be pulled at every site, acute, non-acute, ambulatory offices, and we need to understand the current state and identify what we want to include or exclude to successfully define this. We'll need to identify all of the parametric factors to best optimize spend, those being factors that drive cost.
One consideration is how the scope and goals of the individual project fits into the broader long-term goals of the organization. So an individual sourcing event may be a stepping stone to a larger strategic goal. Let's say, for instance, that you have multiple suppliers in a category and you've identified savings or other operational benefits to consolidating suppliers. It's not uncommon, especially when you're dealing with multiple facilities, that you're going to have staggered contract end dates.
In categories like elevator maintenance services that often feature heavy fines for canceling contracts, you may not be able to reach that goal of reducing your supplier base in one step. You may need to take an intermediate step of negotiating with current providers individually to align those contract end dates, consolidating what you're able to now in order to set the stage for a larger sourcing event down the road.
Having clear goals is best facilitated by good communication amongst the stakeholders and team leading the initiative.
I wanted to talk about this because despite having a clear goal from the beginning, I've encountered many instances of a sourcing project go south because some people think their job is done after the first conversation. They might not understand that they need to approve things on an ongoing basis, either the draft of the RFP, data sets, communication to vendors. Emails can be sent out into the wilderness, never to be opened again. And what do you do if you get 2 approvals of the 10 that you requested after you've done multiple follow-ups? You need to go beyond email for input. You need to pick up the phone. You need to make time for people on their calendars. But even during calls with a massive workload that people have to manage, someone could be multitasking and not being able to provide that valuable feedback because they're focused on something else at the moment, or maybe someone walked into their office.
Let's define what is required from stakeholders. Do you need their explicit approvals or votes of approvals? Can you get them via email or during regular check-in calls? Are your stakeholders additionally committed to regular updates and communication with their leadership? This becomes helpful when you need leadership support for bigger decisions or to encourage end users to commit to the eventual award decision.
Break down tasks into basic steps. Complexity can trickle down into basic requests.
In short, define communication expectations by setting clear and precise goals. Let's talk about some of the political considerations now.
Political considerations can pop up in the most surprising places. We need to identify as many political considerations as we can during the evaluation and planning process at the beginning.
So, as we mentioned earlier, one initiative could be part of a larger organizational goal, and those will need to be defined and understood by all parties.
Another political sensitivity is community interest. Local companies that may be partly owned by the hospital or a partner of the hospital that can also needs to be taken into consideration. And another one is conflicts of interest. So if there are employees that have a vested interest in a supplier company, that can also be taken into consideration.
One way that I try to mitigate this is by trying to align all stakeholders early on in the process. And you're going to have different types of stakeholders, each with different interests. So on the one hand, you may have your end users, and you're going to want to understand what their rationale is for why things are done the way they are today. So understanding that current state involves knowing who the specific vendors they're working with are, why they're working with those vendors in particular, what dictates their buying patterns, and what may be important for them for the future. And that can include perspectives from clinicians or providers and other factors that will drive standardization and utilization. On the other hand, you're going to have executive sponsors of the project, and it can be very helpful to get their buy-in. And to make that case, you're going to want to lean on the anticipated benefits of the project, whether that's savings, administrative efficiencies, consolidation of vendors, or other factors.
And then you have all the other roles in between that includes contracting, stakeholder leadership, and operational stakeholders. Supply chain wants savings, and users want their favorite preferred vendor. And they're looking at your event with different criteria in mind. And so what we need is a solid communication process to bring this out to the surface.
And of course, there are other political type factors that can come in beyond conflicts of interests. For instance, when you have an incumbent supplier that solely has access to the data, we can possibly go through invoices if there are issues with getting data, but often the invoices don't show exactly what you need. You'll need to find another creative way of trying to get that data.
So we started discussions with the healthcare system about sourcing their courier services. They didn't initially let us know about their history and political sensitivities until we specifically asked them about it. The supplier in question was a sole incumbent and knew that if we didn't get their utilization from the incumbent, then the hospital wouldn't be able to get it anywhere else. We may need to enlarge the stakeholder group to collect data internally from the people who are accepting deliveries. So all this to say, you really need to carve out contingencies at the beginning of the process to avoid bigger issues in the middle of the process. When you're devoting a lot of effort and resources in the undertaking of a complex project, it's really important to be able to capitalize on the results. And it's worth taking some time to discuss the importance of clearly defining the goals of the project and what success means to all parties involved.
Right. So planning for all the possible outcomes of your project is just as important as defining the scope. And there you'll want to make sure that when you're designing the parameters around which the suppliers are going to base their proposals, that you're defining workable and realistic outcomes for the project. So, for instance, if awarding to one supplier is the goal, but is not necessarily guaranteed, then you want to make sure that you retain the flexibility to reconsider your potential award scenarios. Using our waste example from earlier, you might have a goal of awarding all waste streams to a single supplier. However, realistically, you might be looking at a split award situation by waste stream or by facility, just because of the geographic or supplier constraints that are involved in this category.
Yeah, and another consideration are there specific services that need to be excluded. So it's important to identify current issues with incumbent vendors and services that can be addressed in the sourcing initiative. And then, we have our proposal scenarios if objectives are not met. So you don't have to paint yourself into a corner.
Yeah, this strategy can be a little counterintuitive in that by defining multiple award scenarios and inviting suppliers to submit multiple proposals, you're actually introducing more complexity. But in the end, having this flexibility worked out in advance can save you a lot of work from going to waste.
Another item that can be a complexity factor is data. Healthcare facilities don't often have great data on what they use or services that they purchase. Options to actually get your hands on this information come from requesting detailed line item utilization or going through invoices. Some healthcare facilities have internal utilization reports, but with purchase services specifically, it's always helpful to request information from suppliers directly so that it can be validated by the stakeholders.
Right. This is true for any category, but it's especially important here given that bad data can obscure award scenarios and throw a monkey wrench into some of the other considerations that we've been talking about. So much has to go like clockwork when you have multiple vendors and stakeholders, and you may be working against staggered contract end dates that you can't afford to delay your decision because you have to put the brakes on the project because of incomplete data.
Going back to this slide, we've talked about parametric factors, factors that drive cost. These data points are the ones that we need to identify and collect. I think one main takeaway is that a lot of the time, just looking at the current contract doesn't necessarily provide all the context and data points that you'll need to consider to source a particular category. Many people are reluctant to go to the vendor, but they often can be a good resource regarding the information you need. And of course, you'll want your stakeholders' input as well.
Right. And it's important to remember that historical data can be a good guidepost, but if you're anticipating large fluctuations in utilization or operational changes that may impact service delivery, such as taking some services in house or vice versa, you'll want to make sure that those plans are communicated to suppliers so that they can plan accordingly as well. Certainly, obviously, over the last year, we've seen a lot of what we would call, quote, traditional utilization patterns severely disrupted by COVID. And depending on the category, that's something that a lot of our customers and suppliers are having to take into account as well.
And it's okay to ask these questions of your stakeholders. What data do we need? It's okay to ask these questions of your vendors, but they may likely only give up the information you request. So you need to know what to ask for.
It's sort of like a cross examination process where you're going to be asking stakeholders what their requirements are, and that will inform your data requirements that you need to collect from your incumbent vendor. In addition to that, it might even be helpful to reach out to prospective suppliers to see what data they need to provide a complete quote.
All right, so we've gotten to the point where you've worked really hard to source this complex project, make your supplier selection, and you've achieved good results, at least on paper.
Right. And this is really just a planning and communication issue where once the sourcing aspect of the project has concluded, the suppliers will typically be champing at the bit to get started. So it's important to make sure that all the necessary organizational resources are lined up and ready to begin the implementation process.
It's really important, especially where steps of the implementation that might involve dependencies and handoffs, that channels for timely communication are created to make sure that each party is kept aware of the progress and prepared to contribute their efforts to the implementation in order to avoid delays and bottlenecks.
So, an example I like to use here is managed print services. This is a category that's very complex from an implementation standpoint, from the perspective that you're going to have current devices that need to be removed by the incumbent, potentially sold if they're owned by the organization. You also need to coordinate the installation of the new devices with IT and the new supplier and make sure that it all goes with minimal disruption and that nobody is without printing functionality for too long. But the way you do that is by coordinating every detail and managing the process along the way.
Our waste example is another. It's very similar. Containers need to be picked up by the incumbent and distributed to the appropriate places with minimal disruption. You resolve this in the same way. Know what the plan is for picking up and distribution.
Right. Oftentimes, we recommend relying heavily on the vendor's expertise in order to get started with the implementation and the planning that's involved there. And with that, I think we've tackled the 6 strategies to source complex categories. The recurring theme you heard throughout is clear and concise communication and the value of centralizing all related conversations, documents, and data requirements.
So let's talk about how to get started. Get organized. Create your timeline and goal implementation date. Take into consideration your current contract end date. You've got to identify your stakeholders, project sponsors, and key vendor personnel.
Mhm. Your key vendors would be incumbent suppliers and any vendors you want to send the opportunity out to. Communication is the underlying key to success. You've got to ensure clear and simple communication with everybody from vendors to end users to leadership.
And you have to nail down software and IT requirements and availability and efficiently collect those data sets. It's really important to track and monitor communications. We actually recommend having a single channel for communication so that everyone has the same amount of access and transparency.
And throughout the life of the contract, you'll also want to continually gather data to measure key performance indicators that are defined in the contract. This will help make sure that the suppliers are living up to all the expectations and can even involve things like including penalties for misperformance thresholds.
Well, thank you, Adam and Malia, for taking us through best practices and for sharing your own strategic sourcing tips with us today. As the example of waste management came up throughout conversation, I thought it would be relevant to end with a case study from an actual sourcing event that this team accomplished. Through market intelligence benchmark reports and a 2-hour competitive sourcing event orchestrated through Conductiv's negotiation platform, we had one customer that tripled its savings impact and reached a total of $1.2 million in savings. To learn more about this case study or others like it, or to better understand how our products can help you to take on difficult strategies, visit our website or reach out to us today. Conductiv solution can be tailored to fit the needs of your organization. So whether you're looking to accelerate the sourcing cycle of your organization or optimize your contracts within these difficult categories, we have solutions available that will help you strategize to meet the goals that you've set for your team. Thanks again for joining us today for our webinar. Have a great day.